So what does the data tell you? Well, a man our age should be having 3 to 4 nocturnal erections per night. Those nocturnal erections, he should have over an hour of nocturnal erections per night as well, too, while he's sleeping. A guy who's 30 should have like 2 hours and 5 nocturnal erections at least. So with that data, you would get notifications. We had one guy who went from 5 to 2, and the 2 were weak, and he got a notification from us saying, "Hey, give us another 4 readings, and this pattern persists. You need to see a cardiologist or your internist." And he did, and he got a catheterization. Another age extreme, we had a guy, 26, 27 years old. He and his wife, she was 30, were trying to have a baby, and they recently moved and changed jobs, and they were attributing their problems to stress and infrequent sexual relations. And she had heard about us from a friend who's our general counsel, got the device, and he was only having 2-week nocturnal erections per night. And he had an adrenal problem. His doctor wouldn't have figured it out, but we kind of clued him in that, hey, this is a problem that has a sexual impact. He would have, his doctor would have been, oh, this guy says he's stressed, basically. He might even put on antidepressant, which would make things even worse.
Are you curious about discovering ways of making your life better? Then welcome to my podcast. I'm Bob Nickman, and this is The Exploding Human. Listen in while I talk with all kinds of people in the fields of personal growth, health and healing, alternative therapies, psychology, spirituality, environment, and the future. I'm looking for those answers that make life better for everyone. You'll meet cutting-edge practitioners, doctors, artists, filmmakers, business people, and those who have overcome challenges. The brave, the curious, anyone who is out there helping us humans to explore, expand, and explode.
Hey, welcome to The Exploding Human. My name is Bob Nickman. My guest today is Dr. ELLIOTT Justin, and we are going to be talking about Sextech. I have to say I knew nothing about this. I found out a lot about it during the interview, which you're going to hear. Elliott's career prior to getting into the Sextech field was that of emergency medicine, so he had a lot of experience with people having heart attacks and cardio problems. And if you're wondering what the connection is between these two things, well, the device which Elliott's company FirmTech has come up with not only enhances sexual pleasure, it actually collects data which can indicate issues going on with blood pressure and the heart and the cardiovascular system. This device, which his company has invented, called the Tech Ring, has a twofold purpose, which he's going to elaborate on during this interview. He explains it a lot better than I do. So let's get started. Here he is, Dr. ELLIOTT Justin.
So happy to meet you, and I'm excited about this topic because I know absolutely nothing about sex tech, as you're calling it, or as they call it, we call it. So I'm super interested in it.
Good, because Bob, I was ignorant about this myself till 3 years ago.
Oh, really? Okay, so you're there's so many new burgeoning fields in medicine, and I love this. And I've had some sexual health people on, but not with technical things and wearables, and I don't know what I'm just wearing my pants. I don't know what else I can wear.
Well, a couple of things. I get a backstory in a moment, but where this is going is, look, Bob, I don't know how I'm 71 years old. I don't know how old you are. 70. I was about to say you look younger than me. Good for you. But,
and I'm really immature. That's why I look younger. I'm very childish.
Well, if you or I went to our doctor and said, gee, when I exercise, my pulse is irregular and I feel lightheaded, like I might pass out. And the doctor put his hand on a pulse and said, yeah, Bob, you're right. Your pulse is irregular. Take this pill digoxin and come back in 3 months. We would think, what the fuck is this, 1900? We would expect CT angiogram, electrocardiogram, blood pressure, blood test, monitoring at home to evaluate this rhythm. And when it comes to sexual health, that's how dumb things are today. If a man, or woman for that matter, goes to a urologist or a gynecologist and says, gee, I like my sexual health where it is. Can you give me some data about how to keep it there? Or I've got a problem. They give you a pill. If the pill doesn't work, they just tell you you're getting old. So what we're doing with here at FirmTech is providing men and women and the healthcare providers with a device that's comfortable, Sextech device, that can give them objective, actionable, and most importantly, personal information about their healthcare. Because when it comes to healthcare overall, we doctors are dumb in the sense that we treat everyone as if they're one size fits all. So we put people in the same dose of antihypertensives, the same dose of antidepressants, regardless of their gender, their weight, other medical conditions. We just give them pills, and then we need technology that can give people data that's objective, but also personal.
But are you saying that this device, or do you have multiple devices perhaps, that this device is a monitoring device that will give information?
That's correct. This is where I was ignorant, as I said at the very beginning. I didn't know about this. But background, I'm an emergency medicine physician, and I can tell you that short of a heart attack or a stroke, there are a few emergencies that concern a man as much as a consistently limp penis. That's about all I knew. My wife and I would play around with cock rings periodically, but they were novelties. They're uncomfortable. They don't give me any data. About 3 years ago, a urologist approached me and said he wanted to come up with a way. Well, he wasn't any urologist. He's a world famous urologist, and he's now my chief medical officer, Dr. James Hotelling, at the University of Utah. He approached me and said we want to come up with a way of counting the number of nocturnal erections that men have when they're asleep. And I said, why? And we know about morning wood, but who cares? He said, well, it's because it's a leading indicator of man's cardiovascular health or of the impact of medications. And I didn't know about that. Now, that's leaking out a little bit because of the biohacking movement into the general population's knowledge, but most people don't know about it. So what do we mean by leading indicator? Well, that's not an association. So in medicine, we treat associations, as in your blood pressure. Blood pressure.
Yeah, I was going to say blood
associated with heart attack and stroke. It doesn't predict it. And when we say something is a leading indicator, we're predicting it. So a man who has a declining number of nocturnal erections, he has a 50% chance of having a heart attack in the next 2 to 3 years, and 88% chance of having a stroke in the next 5 years. Well, that's powerful. So that excited me, and that made me think, okay, well, let's come up with a way of counting these nocturnal erections. But why limit ourselves to erections that men have when they're sleeping? Let's come up with a device that can measure all erections, because what do men care more about? The erections they have when they're asleep or when they're having sex? And that's a rhetorical question. So we had to reinvent the cock ring. So cock rings I'll show you one. Oh, is this visual?
Well, right now I'm just publishing the audio, but I'll describe what you're showing me.
It's an O-ring.
It's a ring. It looks like it's about 2 inches, perhaps, and the
it's kind of stiff.
So it's rubbery.
It's rubbery. It slides down the penis. Yeah. Anyway, they've been made the same way for 150 years. They're made out of silicone, and silicone is a material that's relatively stiff. So these devices have never really caught on, at least in the straight community, because you have to have an erection first, and they then choke off the blood flow. The penis, arterial, and they constrain the venous return.
You get the erection, you put that on, and it sort of holds it there, basically.
Yeah, exactly. So it's kind of like a gasket or a noose.
Yeah,
who wants to lynch the penis? Who wants to lynch the penis?
Like a what do you call it? Like Spanx.
Yeah, really tighter. So I want to do two things. So in order to count the number of nocturnal erections overnight, I couldn't use these rings. Can only be worn for about 30 minutes because they compromise circulation and they're uncomfortable. So our rings are made out of a soft elastomer. It's stretchy, it's spongier. And the advantage of elastomer is that silicone makes you adapt to it. Elastomers adapt to you. So they don't block the arterial flow in. You don't have to have an erection. You can put it on when you're flaccid. You can put it on. It can be worn overnight. It can be worn discreetly. And they don't only constrain the venous return. So they're an erection aid, but they don't choke off the blood flow. So we came up with a new material, which is elastomer, and then we embedded sensors in it. So this is there's a pressure sensor here, strain gauge here.
Like a little nodule of some type that's inside, and you would sort of
got it.
Put that around it, and so it's going to measure things in the veins.
So, Bob, I'm looking forward to your next description because I'm going to put it on a dildo.
Who? Okay.
That's what
that was an attempt at a joke, like you're going to bring somebody out that you consider.
well, or I could just stand up right now. Oh, I got the ring on. You want data that's going to tell you about your cardiovascular health, your sexual health, and the impact of medications or alcohol or supplements.
Yeah.
And do you want to last longer, more confidently, and have a better orgasm? And every guy knows the answer to that question is yes. But straight guys still associate erection rings with crutches or with the gay community or with fetish, and they're wrong. So, I mean, I don't have sex without a ring now.
Right. Well, it also implies. Thank you for sharing that. I appreciate that. It also implies that there's something less masculine if you need.
That's right.
And also there is, sex is still a topic that people are uncomfortable talking about.
The problem is enormous. And so I guess 2 points I would make. One is the size of the number. 50% of men by age 50 have ED. 25% of men have it by age 30. That means they have consistent episodes where they lose their erections. By our age, it's 70% of men. Diseases like diabetes, hypertension, atherosclerosis, these are genuine pandemics that affect the majority of the population over age 50. And most people over age 50 have two of those three diseases. So to have a way on the data side of providing people with data that can change their lives. And we've had 2 men that tell us they got cardiac catheterizations because of the data. We've had 2 men get diagnosed with tumors. They were benign tumors. They were adrenal tumors that were affecting their natural production of testosterone. And they wouldn't without the data. So the goal with data, of course, is to see a problem before it becomes too late or too hard to manage. So utilize this technology, our technology. Men can measure the impact of medications upon their sexual health and their overall cardiovascular health, with antihypertensives and antidepressants being killers of sexual pleasure, but also they're not really good for the heart either. What we're doing is really it's going to change the fields in the practice of gynecology, urology, and cardiology. But on the pleasure side, you and I have been around a long time. Vibrators have been mainstream for women. My mother's vibrator was stashed away in the bottom drawer of a supply closet that she thought we would never find. We didn't know what it was, and we found it anyway. In the 70s or 80s, there's a certain shame associated with women using them. You had to come through penetrative sex. And now that, my daughter takes them on dates, as do her friends. So they've been normalized, whereas erection rings for men have kind of, especially, and every man can improve their performance one, but erection rings have not been mainstreamed and should be, in my opinion.
Well, the thing is, if something is true, it needs to be talked about. Take it out of the shadows and just talk about it. What's the big deal? Especially when you're telling me these statistics are higher than I thought they were. So, what happens? I come to you, or FirmTech is associated with certain physicians. Let's say I go to a urologist. I say, I'm having some ED stuff. And they say, put this thing on and we're going to get some data. How long do you wear it? What is the data that's transmitted? How is it transmitted?
Most urologists don't know about what we're doing yet. But there are 4 research papers that have been accepted for publication. There are 3 more studies that are underway, and the device is being used for research and care at world-renowned institutions, at Mount Sinai, New York, at Baylor in Texas. It's about to be used for a major paper, pre and post prostate surgery at Memorial Sloan Kettering. That said, most urologists don't know. They're learning about it, but it takes time for people to get the message across. Most people actually come to us online. They're looking for a solution. They don't trust their doctors. They have a problem. Just the way people go online to get pills, people find us online. We sold over 12,000 of them, and we have data that no one else has. So you need 4 to 6 readings for the device to adapt to your unique physiology, skin tension, how hard your erections get. So we like people to have 4 readings overnight while they're sleeping to get their nocturnal erections, the duration, the hardness, number of them. And we'd like people to try to have sex with it at least twice. And then with accuracy, we can give people the data. So what does the data tell you? Well, a man our age should be having 3 to 4 nocturnal erections per night. Those nocturnal erections, he should have over an hour of nocturnal erections per night as well too, while he's sleeping. A guy who's 30 should have like 2 hours and 5 nocturnal erections at least. So with that data, you would get notifications. We had one guy who went from 5 to 2, and the 2 were weak, and he got a notification from us saying, "Hey, give us another 4 readings, and this pattern persists. You need to see a cardiologist or your internist." And he did, and he got a catheterization. Another age extreme, we had a guy, 26, 27 years old. He and his wife, she was 30, were trying to have a baby, and they recently moved and changed jobs, and they were attributing their problems to stress and infrequent sexual relations. And she had heard about us from a friend who's our general counsel, got the device, and he was only having 2-week nocturnal erections per night. And he had an adrenal problem. His doctor wouldn't have figured it out, but we kind of clued him in that, hey, this is a problem that has a sexual impact. He would have, his doctor would have been, oh, this guy says he's stressed, basically. He might even put on antidepressant, which would make things even worse.
26 is pretty young to have issues like that. That's I couldn't sit still at 26. Let's put it mildly.
But we all get issues as we get older. So one of the things we've learned is when I'm pushing rings, but my point is every erection ends in a venous leak. Blood leaves the penis. So venous leak to urologists means 2 things. One, it means men who are born with this problem and discover that when they're teenagers that they get erections, they lose them really quickly. And those men there's really only surgery that will work for that. And that's a very minority of the problem. Venous leak for older men is not uncommon, and it's due to aging of the blood vessels. So I don't know about you, Bob, if I sit on a plane for 5 hours, I'm a good physical condition, but if I sit on a plane for a few hours, my socks might get tight, my rings might get a little tight, because the smooth muscle around my veins is no longer pumping the blood back to my heart the way it did when I was 40 years old, 30 years old. And the way that affects the penis is the smooth muscle that holds the blood in the penis on the venous side weakens with age. And that's just inevitable. And that's one of the reasons why, but you're 14 years old, you hold a girl's hand, you have a hard on for 3 hours. It doesn't happen to me at age 71. My wife and I make love frequently, but foreplay doesn't keep me hard for 3 hours. It's just the way it is. And so a ring is a mechanical solution. I break erectile dysfunction down to 2 groups. Men who can't attain erection, they need to see a urologist and a doctor. They've got a significant problem. But the majority of men, even older men, the different issue is they can't sustain erection. And that could be psychological, distraction, boredom. No one wants to talk about that. Alcohol, marijuana, medications, heart disease, diabetes, all these things that can have an impact upon the ability to sustain erection after you get it. A ring is a mechanical solution to that. Every erection ends in a venous leak. A successful erection or not successful erection. Rings are a comfortable ring is a really valuable. It's a game changer for men.
How is the information, the data transmitted?
Sure. The data goes to the cloud. So we're HIPAA compliant, Privacy Act compliant. I don't have access. There's inside the device. There's a Bluetooth antenna. The Bluetooth is off when it's on your body. So there's no radiation concerns, although your cell phone is a lot more powerful. There's a radiation. The device goes to the cloud. Your name gets translated into numbers. There's only one person in the company who has access to who could take my data, who could find my data without my permission. People do give permission if they want me to analyze their data. They can also share their data with their doctors by giving them screenshots. A few clinics have set up data rooms where every person from that clinic who's using the device, the data goes automatically to a private area where the doctor has a password. The doctor can go in or nurse can go in and review their data. But the data is also stored in your phone.
So you get a lot of great information, and then you go from there. And then, I guess some people, like you were saying, a lot of doctors don't know about this, or they find it to be something they don't quite understand or ready to use yet? What do you do with the information if you have to find a certain doctor that's willing to kind of look at this stuff, or are most doctors pretty open to it?
Most doctors in our experience are open to it. I've had, again, we sold over 12,000 devices. We have tens and tens of thousands. We have data that no one else has. And I've had 2 doctors contact me to have me explain to them, because they didn't want to be ignorant in front of their patients.
Well,
it's embarrassing to a doctor.
Well, it's also a wise choice. It's that the person actually cares about learning new things. So in conjunction with this information, I guess a person could say, well, I have this and this, and certain issues are presenting themselves. So you get this information, and then, you know, let's talk about treatment for a second, because there's a couple of ways to approach these things. If you have, you know, if you have a blood pressure issue, you can treat it with, you know, blood pressure medication, but there's also lifestyle changes that people can do. And a lot of the things you describe are actually lifestyle diseases like diabetes and, you know, so some of the cardiovascular stuff. You know, there's too much bad diet and sedentary living and all these things that, you know, we can create these problems for ourselves. But then there's other things that just, you know, bad hop of the ball, things happen. So, you know, how much, I guess it's really up to the individual's doctor. I mean, you're not giving medical consultation on treatment is what I'm hearing.
No, we give advice. And we do tell everyone to discuss a change in medication with that are suggested with their physicians. But people don't, Bob, we got to be frank, people don't trust their doctors today. You know, most of the people that I speak to. So again, we've had thousands of clients. I've probably spoken to 175 people overall. Most of them are people with advanced degrees who are trying to sort it out on their own. They're already seeing 2 or 3 doctors. They're on 5 medications. They go online. They see that a lot of the medications they're put on for blood pressure or depression or for flow because they have prostate disease are medications that are associated with erectile dysfunction. I suspect that most people are doing it on their own. But ideally people take this data to the healthcare providers and would come up with a new plan. So I'm at least a couple of times a week, I have people communicate, you know, to me that's how they're utilizing the technology. The devices are also being used by people to test the impact of supplements. There are many supplements that, you know, claim they can increase a man's energy, virility, et cetera. People can then measure the impact of those things on themselves. We have found virtually nothing, no oral supplements to be of benefit whatsoever. There is one supplement combination that involves 3 different supplements that it seems to be effective, and I've seen the data. I'm not allowed to disclose it, but it's a combination. I'm not allowed to tell you the brand, but I'll tell you it's a combination of L-citrulline, L-arginine, and maca root. That appears to have some benefit. We have had men increase their nocturnals by radically changing their lifestyle habits, losing weight, and exercise regimens. But the other thing that people need to bear in mind about their sexual performance is that it is largely a smooth muscle function and not a skeletal muscle function. So you can go to the gym, you can work out the skeletal muscle, you can specifically improve your pelvic floor tone. But the only way to maintain the muscle tone in your penis is by having orgasms, having erections, having orgasms. So we doctors make recommendations about diet, health, exercise. We're too embarrassed to make recommendations about sex, but we should. So we know, data at least, that it says that men who have an orgasm every day have half the cortisol levels of men who have orgasms twice a month. Well, that's a big, big difference. That study was on men in their 40s. It's probably true for my men our age as well, too. People think the social benefits are enormous, too. Couples that have sex twice a week versus couples that have sex twice a month have half the divorce rate. I mean, divorce is people's sexual performance, people's happiness in their marriage is something that doctors don't ask about. I've never had doctors say, hey, are you happily married? Hey, you and your wife, never, ever, ever, ever. And they should. People's primary relationships are have an impact on their cardiac health, their respiratory health, their immune system, the mental health. There's a big study in the United Kingdom, and I suspect that applies to Americans as well too, showing that men over the age of 70, controlling for diabetes, hypertension, atherosclerosis, if they have sex twice a week, they cut their risk of cardiac death over the next decade by 50%. Now they're going to die anyway, but that, people should, I guess, again, if I'm pushing rings, I'm also pushing, and data, I'm also pushing the fact that people should have more sex than they currently have it.
Well, I'm going to say that's a great idea. There doesn't seem to be any downside to that, other than some sort of bizarre religious guilt or something. Yeah, I had a guy on this show, and I can't remember his name. I was just trying to look it up while you were talking. He has a YouTube channel, and it was something like he'd written a book, Everything You Need to Know About Your Penis. He's a guy in
Abe, he's in LA.
No, this guy's up in like Sacramento area, and
okay, then it's not different.
He's written a book with a bunch of other doctors about sexual health, and it's and he's very open about, like you are, about talking about this stuff. And one of the things he was telling about, he has in his office, that's changed men's lives. And I want to talk about women here after this, because we're just talking about men, but you sit on this device, and it basically works on the muscle, increases muzzle velocity, basically. Let's put it that way.
Yeah, I've sat on that device.
Yeah.
A couple longevity clips. So the device is basically electrical stimulation of the pelvic floor muscles.
Yeah.
And that's valuable. But as I said before, sexual function is more about smooth muscle than it is about skeletal muscle. You do need skeletal muscle, but I'll tell you an anecdote. And again, I have an NDA, so I'm not going to say there's a woman in this country who has several pelvic floor clinics specializing in pelvic floor health for men. Because it's more common with women, but men have issues as well too with the pelvic floor, and it affects their bowel function and the urinary function. And she bought several of our rings to test, and why she wanted to write a paper, and there was no improvement in erectile function. She was, her presumption, and the presumption, frankly, in the scientific community right now, because they have no way of following this objectively, is that if a man improves his pelvic floor tone and strength, that his sexual performance will improve as well too. Now, it could be that those men are also losing weight, they're exercising more, therefore, there are benefits to the sexual performance. But in her particular analysis of 35 men, and this is data that will never be published, there was no improvement. So I don't think sitting on that device is going to have much impact on a man's sexual health.
I don't know. It was just an interesting conversation. I'm not going to do it, but it was kind of an interesting idea. I mean, his claim or his experience, I don't know. I trusted that what he was saying was what he really believed. That it did help quite a number of men to, they weren't necessarily having any kind of sexual dysfunction, but they were having an increased sort of, when you're young, you can hit the ceiling, and when you're older, you can't. And so it was proving that. I don't think, I didn't hear any association between that and any other dysfunction. So it was an interesting topic.
What we're doing is really disruptive because we're giving people an objective measure.
I love it because the thing aside from the pleasure thing, which we all love to feel good and have pleasure, but the idea that, you can monitor your heart health, because, what is the heart attack rate in this country? It's huge. Sure. I mean, you hear it all the time, and you've heard it for a long time, and there is some increased knowledge, but taking a statin isn't going to prevent that, that's precarious anyway. A lot of people, are saying, well, the reason there's so much statin prescription is because, it's a prescription and people can make money off of it, and they're pushed like crazy, and the numbers get lower they slowly are getting lower. So where you need it now, and it's like, well, why aren't you telling me about lifestyle changes if I'm headed in this direction? You got another 10 numbers to go before we give you a statin, or you're one over, so you got to have it. So,
right.
it's bizarre.
Well, everyone who's prescribed a statin should probably get a calcium angiogram, because what do you really care about? Your cholesterol level? I want to know what's going on in my heart vessels.
Yeah, that would be
That's
nice.
not the way healthcare works, unfortunately.
Yeah. No, I know. It's if there's no drug for it, we don't want to diagnose it. It's an odd sort of ass backwards kind of a thing, but we're here to talk about. So basically, your market is, and we might as well talk a little bit about the business side of it. Your market is urologists and cardiologists primarily, and people who deal.
Well, my market is you. And we're selling most of our.
Well, I was getting to the civilian population.
The doctors need to be educated, but almost all of our sales are direct to consumer.
Oh, okay, yeah. And then, have you had like pushback from doctors, where they go, "We don't know what this is, so we don't even want to hear about it"? Or
not. I thought I would, but not much. It's more what I hear from doctors is, the straight doctors is, I don't need it. I don't really care whether you need it. It's your patients that need it. It's really extraordinary how quickly so many straight doctors go to their male pride.
Wow. Well, yeah, it's not. You go to the doctor and I'm here because of me, not because of what you need. Right. I have to ask my doctor about this.
You mentioned women before, so we have developed a device for women that can measure the clitoral health.
Okay.
It's a prototype that cannot be commercialized. We have developed a commercial form, and we have developed our goal over the next 3 months is to marry the sensors to this commercial form. We will launch this product in the latest, the third or fourth quarter next year. If I can raise money, then it will happen sooner. I could have this product in the market in 6 to 9 months, but I don't have, I don't know the personal money. The male side of the business was funded by me. I don't have the personal money to fund the female side of the business.
So what happens to women at night and during the day?
Women have erections at night.
They do.
Women have erections at night. It hasn't been studied since Madison and Johnson. They were waking up women like every hour. Our thesis is that we need to get baseline data, but our thesis is that women probably have the same number of erections that men do at night. And those erections, or let's call them arousal episodes. And so the goal, of course, is to count how many and to measure the engorgement of the clitoris. And we've done that. We can also measure the pulse amplitude. We can measure the blood flow changes that occur with arousal that we're measuring as well. So women, postmenopausal women lose their protection against cardiovascular disease, and they have all the same problems that men do with diabetes, hypertension, atherosclerosis, heart attacks, obesity. They have more problems than men do, probably. Younger women take hormones and birth control, which have an impact on their sexual health as well too. So it's really critical for women to develop a device that can help them sort out what makes things better for them and what makes things worse. And that data should be personal and objective, just the way it is on the male side.
Mechanically, I can understand how this elastic or whatever the material is, ring, fits over a penis to measure. How does you insert it into the vagina? I'm looking at something.
Yeah. So
it's similar looking, but it's
this
long.
end goes into the vagina.
Okay.
This end rests over the clitoris.
Okay.
So there are sensors here.
Like a loop almost. Yeah.
It goes behind the pubic bone.
Mm-hmm.
And there are sensors inside the vagina that measure muscle contractions associated with orgasm. That's interesting. That's fun. But I'm more focused on the health of the clitoris because there's no way of assessing outside of a Doppler in an office. No way of assessing blood flow in the clitoris. So, and we want to know what's going on both overnight and when women are having sex, because we want to be able to measure the impact of diseases, medications, et cetera, upon a woman's sexual performance.
So that's actually stays inserted during sexual activity.
Stays inserted. It's been tested by an N of 2. So my wife and I are the only people that have had sex with this so far. And the goal was to come up with a device that would not be expelled overnight and could be worn comfortably in multiple sexual positions. There are several other volunteers here in Montana who will soon be testing this as well. But I think we have the form works, it's comfortable, pleasurable, during sex. It does not interfere with penetration, et cetera, et cetera. So the next step is to marry the sensors to it, and then code the data. The team is in Berlin. It'll take about 4 to 6 months to accomplish that.
It's not very long.
No, and if you could find someone to give me $750,000, I can accelerate that process.
Oh, let me ask around. I might know a guy. I don't know.
It's been very difficult to raise money. The problem really is that it wanted sex, but the other is that it's not a me-too device. VCs are much more comfortable investing in something that's been done before than investing in something that's new.
But it's one of those things that when it happens, then it'll just explode.
No doubt. Women buy more sex toys than men do per cap. Women are more interested in the health than men are. The female device will be both popular and valuable.
What I'm loving about what you're talking about is the wedding, the marriage between pleasure and health. Like they're almost considered in some circles to be exclusive, mutually exclusive of each other, and it's the opposite. They're
yes.
It's like if you're experiencing genuine pleasure with your biological gift of having this body, well, how is that not healthy for you in every way? It doesn't make sense. It doesn't make sense that it wouldn't be. So this, I think you really hit on something here with, I know it's a medical device too, but there's something very wonderful about bringing that type of connection to people to where they know that they're doing really two things at once or more. Really, it's got a little bit of a synergistic effect, I would think too.
Yeah, and we want our mission is better sex and better sexual health for everyone, so people can enjoy a longer lifetime of lovemaking and health. What's kind of, I think it reflects something wrong with our society. My wife is my marketing director. She's not because of nepotism, but because she's a talented artist, and so working together in this project, which has been a lot of fun. But I'd say every 2 or 3 days, especially had a couple of drinks, look at each other and think, how did we end up doing this? Urologists and gynecologists should have done this 25 years ago.
Yeah.
And one of my friends says, well, he's a Christian. He said, well, it's just, frankly, it's providential, because it needed a doctor, someone interested in research, someone interested in sex, with an open mind to do this. And so also someone had enough personal means to execute without having to go out, and raise money. But there must have been more people like that in the world. I mean, when this doctor Hotellian came to me with this idea of counting the number of nocturnal erections, and my thought was, well, let's count all erections, and let's embed sensors in a cock ring to do that. Well, he's what I call a cock ring version. At least I played around with him, so I had some sense of what needed to be done. It's for me. This is a legacy project. I've started 6 companies. I've had 4 exits. I've done well, but all those other projects were sold, disappeared, corporatized, gone. The quality aspect. This is going to, we might not end up making the big money here. It'll certainly be copied, but it's going to change urology, gynecology, and sexology.
That's why I love doing this show. I mean, I get to meet people that have a passion about something, and they're not afraid, and they really want to help other people. And this is a great thing. Best of luck on this.
Well, thank you.
Let's just talk about the cost of the consumer. Like I go to your website, what happens?
Sure. The device with technology costs $275. And without technology, it's $60. There's no additional cost for the data. You own your own data, and you own every update is free.
So it's like $300, $350, something like that.
Right. So you can buy both together for $295.
Mm-hmm.
The device without technology is a little bit different, because I want to make a man's pleasure more intense. So these other cock rings, these O-rings, they're just a gasket. The goal is to keep a man hard. Our device, this was designed to prolong the ejaculatory phase by 50%. A man drops his testicles in and it wraps around. But I want to put the right amount of pressure over the urethra to increase the ejaculation phase by 50%. I tested on 11 men age 27 to 70. I was the oldest guy at the time. So my ejaculatory phase goes from 4 seconds to 7 seconds. Well, that's a really intense orgasm. And so that's why I said I don't have sex without a ring. Now, why would I? I'm going to last longer and have more intense pleasure. So we sold about 2,500 of the rings with technology and about 10,000 more of the rings without the technology. Well, they're less expensive, but they're also they're very effective for sustaining erection for pleasure.
I mean, that's really more on the pleasure side of things,
right?
Than the informational side.
People go to the website, and that's and they can get the bundle for $295, or they can buy them separately for $275 for tech and $6 for for the non-tech variant.
Say the name of the website again, so everyone knows.
Sure, it's FirmTech, MyFirmTech, myfirmtech.com.
It's an easy name to remember.
Yes. I have a daughter in marketing, and she came up with FirmTech.
Good job.
And the female device, you can follow us at myfemtech.com, which is MyFemme tech.com. We have a story, and people can see the progress as we move towards commercialization of it.
You don't have to be particularly good looking to use these, folks.
No, you don't have to be good looking. You're
a handsome man, but what can I say? You don't have to be good looking. You just have to have a desire to improve your health and your pleasure. And
your partners will appreciate it too.
Yeah, I wonder how there might be some resistance from a partner too. I don't know if you've run into that.
The resistance is usually the resistance is actually usually on the male side to using a cock ring.
So women come to you and they go, help.
Women are over it. They're like, hey, I'm my man needs this.
Well, I'm thinking next Father's Day, when that comes around, you can't think of what to get the dad or hubby. And he's got enough ties. He's got golf clubs. Get him one of these. See what happens.
We ran a Father's Day campaign that said, it's time to have that talk with dad. And we got a lot of negative comments from people in the advertising industry. That's totally stupid. And we sold a bunch of devices though. But the ones we sold were the non-tech variants. It was less expensive, and it's an easier gift, to give. Yeah. But it is time to have that talk with dad. Well, our more popular messages on Valentine's Day is, this time you put a ring on him.
Well, I'm loving the marketing part of your business. Well, thanks for talking to me today. What a fun talk. Oh my goodness. I had no idea what this was going to be. I'm very impressed with the whole thing. Folks, FirmTech.com. And
that's right, FirmTech, not SpermTech. FirmTech.
FirmTech, yeah. Did I say sperm? No, I did not.
No, I think it's what you said.
I did?
Sounded like it. It's myfirmtech.com, and I really appreciate being here. It was a very fun conversation.
Yeah, and best of luck to you. And folks, do you answer questions if people,
I do. People can reach me at Elliott, ELLIOTT at myfirmtech.com. And if they do contact me, I can give them a 20% discount.
Look at that. Elliott, such a pleasure to talk to you today. Have a fantastic rest of your day. Enjoy the beautiful weather in Montana. And folks, you know where to go to find out more.
Very good.
These devices and what your health and your pleasure. Thank you so much.
Thank you.
Much appreciation for you folks listening to The Exploding Human. The website is theexplodinghuman.com. There is a YouTube channel where you can listen. That is The Exploding Human with Bob Nickman. Once again, I want to thank Dr. Elliott Justin. And if you want to find out more about what's going on, it's myfirmtech.com. And if you use the code IKNOWELLIOTT, you can get a 20% discount. Have a fantastic day. Thank you.